So President Trump jumping into the fray to promote the GOP bill to replace Obamacare, hosting parties and dinners to convince conservatives to support the legislation. And while the president wines and dines, House Speaker Paul Ryan has embraced his role as the bill's main cheerleader.
This law, Obamacare, has 1,442 sections or instances that gives the Secretary of HHS enormous amounts of discretion to administer health care, meaning I don't think Barack Obama, Nancy Pelosi, and Harry Reid, when they crammed this bill through, ever thought Donald Trump would be president and Tom Price would be the Secretary of HHS. So, number two, in our three-pronged approach, administrative action where the Health and Human Services Secretary deregulates the marketplace and allows more choice and more competition to come into the marketplace.
Although I don't know how many cheerleaders do PowerPoint, but still. Doug Schoen is a former pollster for President Clinton, a former Bloomberg advisor, and a Fox News contributor. Kevin McCullough is a nationally syndicated radio host with Salem Media Group. Guys, thanks to both of you for joining us. Doug, if you wanted the president to succeed, you were his advisor, he gave you a call. What would you tell him to do right now?
I do want him to succeed. And what I would tell him to do is, given the Freedom Caucus and how intransigent they are, I would say go to the Democrats, try to work out a joint solution that is bipartisan so that we ensure people are covered.
But would they go along with that? I mean, it seems like at this point Democrats have very little incentive to pitch in and try and make this work.
Well, it's a way to salvage the legacy of Obamacare, to prove in the 10 or 11 states where senators are up, where Donald Trump won, that they can cooperate. And you know what, something else? I do want the president to succeed. I'm a Democrat, but I am an American first, and I want people to have health care, affordable health care. I don't want insurance companies to fail.
So you say go to the Dems. What advice would you give him?
Well, and Doug is demonstrating why he's a good Democrat, and congressional leaders, particularly Schumer and Pelosi, are bad Democrats, because you're right. There's no incentive for them to come to the table, and they are pitching in just as equally and as hard as they criticized McConnell for doing at the beginning of Obama's term.
So what would you tell the president to do?
The president has to do what he's doing. He's Reaganizing his base. He's talking directly to them through Twitter. He's going to these stadium events that he's going to have in the 10 or 12 vulnerable seat states. He's going to have Ted Cruz up for dinner. He may have Chuck Schumer over for dinner. They're going to talk about this. He's going to work this out. This is going to pass. It may not be in the exact form that it is today, and those on the right and left are both going to have to deal with it a little bit, but we're going to get some things changed. The mandates are going to be gone. There's going to be some advantages to the American people.
We're hearing about the bowling and the pizza, and even, I mean, we've heard all along through this campaign from people who really did not like Donald Trump, that when he gets you one-on-one, he's very charming.
Well,
and that he has a way of, so is it possible that he could do something others haven't in terms of getting people to come together and say, look, here's the one thing I really need. Okay, you need that. What about you? What do you really need?
Well,
is that possible?
Look, I think they can get a bill narrowly through the House. I think so. Not sure. What form it's in, we'll have to see. The Senate's going to be very tough, but I believe that you govern with a broader mandate than just narrow majorities. That was Obama's mistake, and if Trump doesn't do a bipartisan deal, that will be his mistake as well.
Yeah. Kevin, you know, do you agree with that, and do you think he could actually get both sides to come together? Because one of the criticisms he faces is that he's, quote, post-ideological, which in my mind is kind of an insult. You know, they're saying
I'm not even sure what that means.
Right. It means that he's not going to stick straight. You know, I am a conservative, I am a Republican, that he would meld together ideas that normally no one else would be willing to accept in the same bill.
On
do you think
some
that's
level,
possible?
he is that person because he got blue-collar Rust Belt workers to vote for him in 4 states that should have never gone red. So what he does have to do is go to the people. If you keep doing what Reagan did and talk to the people and make sure that they are the ones that are really driving the dialogue and not the interests that are in Washington, which are entrenched in both parties, that kind of have turf to protect and still want to, you know, kind of win those battles at the end of the day. Keep talking about fulfilling the promise that you campaigned on and do as much as you can to make it as free market. I think he's going to be fine.
Does that work in this case? Because what the people want is great health care very cheaply. You know, I mean, when you get down in the details, I think a lot of Americans tune out. So at this point in the process, Doug, I don't know that going to the people, other than saying, don't worry, you're going to have health care, really works.
Well, I think you have to go to the people, certainly. But you have to have something to sell. And if 15 to 20 million people conceivably are going to lose their health care, and if the exchanges are going to fall apart, you're not selling anything. I think Kevin's half right. You need to go to the people, but you need a bipartisan plan that has broad support in the Congress, that achieves the broad objectives we've been talking about, then you can sell it.
The amount of people that lost health care under Obama through having to take lesser plans or different plans than they had, compared to the people that got it, it's a basically even wash. What we're talking about here is constructing health care differently. Get rid of the mandates, make it for more free market purpose. You help small businesses. If you give people more of their own money back, you're going to end up being able to afford better health care.
Okay, guys, thank you.
Thank you, Melissa.
Thank you.
Thank you.